remember you know that we reschedule things so you'd have more time to study for your upcoming.
Yes.
Okay.
Thank you. Yeah.
All right. If you did not get the answers, or the review even, for blood pressure, blood vessels, and circulation, email me at my personal email address, Comcast.
First initial, last name?
No, it's in the syllabus.
Yeah.
Cool.
It's on the syllabus. And I will see that you get it. There goes my pride.
You know they're all going to come in tonight.
All right, well, whatever. Okay, the immune system. Now, the immune system is not one we can just wrap our arms around so easily. It's not like the cardiovascular system, you know, the heart and the blood vessels. You can see those models and all, but the immune system, I mean, there are organs that are involved with our immune system, but, you know, they're not in our everyday conversation. And a lot of it, most of it, of course, is microscopic. All right, but we're going to be dealing with that. I have already dealt with it some in the lymphatic system, you know, and we'll deal with it further in lab. But I can assure you that if it weren't for our immune systems, we wouldn't be here today, most likely. Now, when we talk about body defenses, and we're not talking about specifically the immune system, although that's in it, but if we talk about the broad category of body defenses, we'll see that we have some non-specific defenses that protect us across the board without specificity against foreign things that can injure us. So that's this category right here, our non-specific or innate defenses. But you notice it protects us against any foreign agent, but it doesn't confer immunity. Whereas this aspect of our body defenses down here protects us against very specific agents. This is our immunity, our immune system per se down here. And of course, this does confer immunity. But notice that they work hand in hand. And we'll see this in a little bit later. You'll see that when something foreign enters our bodies, it's not just our immune system that acts against it. Our non-specific defenses act against it too. And so graphically, this is the way it looks. Our non-specific defenses or innate defenses encompass these things right here. You know, we have surface barriers in our skin and mucous membranes. We'll talk about these things here that are part of our internal defenses. They're non-specific. And then we have our specific defenses down here, so-called adaptive defenses. And here is where our lymphocytes come in. We've been talking about it. Our T cells and our B cells. So we'll be talking about these things too. So let's talk about the first line of defense. Skin is protected. Our saliva is even protected. Our stomach lining produces hydrochloric acid, doesn't it? So a lot of things that get down in our stomach are killed by the highly concentrated hydrochloric acid in there. Our respiratory tract produces mucus, and these little extensions off the cell membrane called cilia that sweep that mucus that's trapped foreign things, to sweep it back out, away from the delicate air sacs down here. Surface antibodies. You know, we have a class of antibodies that resides on our mucous membranes. And protects us against things before they even get into our organs. And by the way, just as an aside, we'll talk about immunizations later, but when you are injected with a vaccine or an immunization, you are bypassing actually the natural way. You're bypassing a specific class of antibodies that I'll show you later, which have the job and do a better job of producing immunity than when you're actually injected with something. Because you're bypassing these surface antibodies on your mucous membranes.
So you're saying is you would be better off actually getting the disease, so to say, rather than being vaccinated against it? Your body reacts differently to actually receiving the disease?
Right.
Oh.
I'm going to mention this later.
Okay.
Is that
Yes,
why?
the traditional view is that we should be vaccinated against all kinds of stuff, and the things that we are being recommended we be vaccinated against are growing in number. But I'll deal with this a little bit later when we get to that aspect. But I have some information that might surprise you. That's to keep you awake, just in case. All right, so our second line of defense. And here's what we're going to talk about. There are certain cells that are specifically involved with this. And we've got this inflammatory response we want to talk about because inflammation is fundamental to the body's response to foreign things that invade it. And there are some specialized proteins that protect us against foreign things, and even fever is a line of defense. So let's look at the cells. The cells that help us, aside from our B cells and T cells, are mainly cells that are phagocytic. So the main ones of our white blood cells that are phagocytic are the neutrophils and the macrophages that we are familiar with now. So this is just a brief review of how phagocytosis works. These cells envelop foreign things into their cytoplasm, break them down enzymatically, and then secrete whatever, or excrete whatever they can't use themselves. That's the basis of phagocytosis. Here is an example of phagocytosis with neutrophils. So you have an injury here. These neutrophils, and you probably recognize some of these terms that we've talked about right here. Now, what does this word mean?
An abundancy.
What did I tell you? When a word ends in O-S-I-S, suffix, what does that mean?
No, that's ISIS. An
It means
abundancy.
full of or an
An
abundance of.
abundancy.
So we have an abundance of leukocytes,
Because
white
they're
blood cells.
into that.
They line themselves up along the wall of capillaries and sneak out between those, in those spaces between the cells. They are actually drawn to the area by chemicals that are part of the inflammatory response here. And you see here they're phagocytizing bacteria that were introduced here. So that's just an example of phagocytosis with neutrophils. However, these are the main phagocytic cells. This is an electron photomicrograph of a macrophage enveloping bacteria by cytoplasmic extensions, as you see here. This is, of course, highly magnified. What white blood cells do these macrophages come from, did we learn?
Monocytes.
Monocytes.
Monocytes. Excellent. All right, now one class of our lymphocytes, we have different classes of lymphocytes as we're going to find out. But one class of them, making up about 5 to 10% of the total of the 10 to 12 trillion that we have in our bodies, are called natural killer cells, or NK cells. Now, they are part of our non-specific defenses. We don't get immunity from anything that these do, but they have a role. So they are constantly roaming the body, surveilling what's going on. They're looking for foreign antigens, they're looking for malignant cells, and when they see them, they attack them directly. It's a direct attack, and they do this by perforating holes, puncturing holes in the cell membranes. The attack is immediate, but they're not phagocytic, but they act by putting holes in the cell membrane, which of course kills those cells. Now, notice here I'm making a reference here to self-antigens, because later I'm going to tell you that antigens are generally thought of as foreign substances to the body. But our body's cells actually have on them self-antigens that are unique to that individual. So these natural killer cells will detect the absence of self. So they're looking for foreign things that are not identified by belonging to self. All right, so the inflammatory response is part of our general defenses, isn't it? And this is very basic. Now, the inflammatory response is usually a localized response to injury by whatever means. You know, we saw the earlier thing of a nail or something in the skin, but you know, inflammation can occur apart from an injury. It can occur as a result of lifestyle habits or things we eat and that sort of thing. But generally, it's a localized reaction. So what the body is trying to do is localize the reaction and keep it from spreading, trying to deal with it in a localized fashion. Notice that the inflammatory response is combined with our body's specific defenses, immunity, our immune system. So they work hand in hand. Now this kind of busy slide here reviews what's involved with inflammation. Here's what happens in inflammation. At the site of injury, blood vessels dilate. They open up. And when they dilate, blood flow to the area increases, doesn't it? And they become leakier. Those intercellular clefts open up, and they release some of their proteins from inside the bloodstream. So we have leukocytosis going on that I showed you on the earlier slide. So we have dilation of blood vessels. They become more permeable, so increased capillary permeability. And we're leaking protein-rich fluid into the area. So we're increasing blood flow, we're leaking protein-rich fluid into the area, and our white cells are coming with that protein-rich fluid. So our neutrophils, our macrophages will come with that, and our basophils. Remember, we couldn't find many basophils when we looked on the scope, because in normal blood, they're not very numerous, are they? But in the inflammatory response, they increase their numbers, and they release a couple of important chemicals.
The histamine.
Histamine.
And
what is
heparin.
histamine?
Well, it's your body's reaction to allergy.
Vasodilator, isn't it? See here? It dilates arterioles. And what else besides?
Heparin.
Heparin. Heparin is a blood thinner, right?
Anticoagulant.
Thank you. It's an anticoagulant. All right. So that's what's happening in inflammation. So when we're releasing these protein-rich fluids, aren't clotting proteins dissolved in plasma? So some clotting proteins get out into this area of inflammation, right? And what happens is a clot is formed around the perimeter, and the central part is liquid. And so our white blood cells and our proteins can work in there. You know, our nonspecific defenses. That's what the heparin is for. All right, now, so if you've got increased blood flow, increased capillary permeability, all right, and leakage of other things out into that area, that's going to produce some classical signs of inflammation along with the symptom, which you see in red right here. Okay, so these are the classic signs and the symptom of inflammation. Now, what is the difference between a sign and a symptom?
Sign is something you see.
A sign is something you can observe, you can feel, you can listen to. Okay. And what's a symptom?
Something the patient feels, can describe.
Something that the patient, the person can describe that they feel. All right? So, on this list here, which one is the symptom? Pain. Pain. And the other three are signs, aren't they? So, these are the classic symptoms and a sign of inflammation. Now, let's get some terms straight here. So inflammation, you see, is a complex series of events that's usually localized, and it's in response to any kind of injury to the body, external or internal. All right? Now, infection. Is infection the same thing as inflammation?
No.
No. Infection is just inflammation plus the presence of pathogens. All right? Exudate, that protein-rich fluid that may exude to the surface of a skin injury or a soft tissue injury is an exudate. And of course you can have internal exudates as well. So think of a burn injury. Think of maybe a scald burn, which is typically going to be a superficial to deep second-degree burn. It forms vesicles or blisters, right? And sometimes they break, right? And you get a fluid there on the skin that sometimes will dry out. That's an exudate, or one type of exudate.
Like a watery fluid almost?
Yeah, it's watery, but it's a little thicker than water usually. All right. Now, what is pus? Pus is the result of an infection. So we have our phagocytic cells attacking pathogens, bacteria. Right? So that's probably going to kill some tissue cells. It's going to kill some of the white cells. And the white cells, of course, have killed some of the bacteria. So it's a mix of those things. So you can have dead or dying neutrophils. Remember, neutrophils that are active against bacteria have a lifespan of seconds. So they're being bumped off rapidly, but they're taking some bacteria with them. And so, and of course, there can also be living bacteria in that pus. All right, well, what's an abscess then? An abscess is a localized collection of pus. So, if you have an abscess, of course, if you go to get treated for this, you're probably going to be treated with an antibiotic, aren't you?
Yes.
Would you like to cancel, yes. All right. So you'll be treated with an antibiotic. Is that going to be sufficient? No. Rule of thumb. Rule of thumb. You have an abscess, you have to drain it.
Right.
You won't really get well until you drain the pus. Now you can have abscesses deep. You know, it's not just on the skin. You can have abdominal abscesses, thoracic abscesses, brain abscesses.
How would you know? Would you just be in pain and you see the doctor and they run their tests and they go, "Are you gonna abscess on your stomach?"
Yeah.
Okay.
Yeah, well actually, if you have it in here,
Mhm.
oftentimes it will follow, say, an operation.
Okay.
Say somebody has a ruptured appendix.
Okay.
You operate and you remove the appendix that's ruptured, it's spilled bacteria into the abdominal cavity. Well, you wash it out, you know, irrigate copiously and hope that's going to be okay, but you put a drain in
Okay.
just in case. Let's say some bacteria got out and you didn't know it,
Okay.
and later they developed a fever and didn't feel good, and some abdominal pain. You investigated, maybe did a CT scan, abscess.
Okay.
You have to drain it.
Okay.
So, pus is, so an abscess is just a greater collection of
It's a
pus?
localized collection of pus. That area of inflammation has been walled off, and the body has tried to retain it
Right.
and keep it from spreading. So it has boundaries, but you've got to drain it.
What if they never drain it?
You would die.
So if you take like,
If you never drained it, it would drain itself. One way or the other, it is going to drain itself. It's going to come out. Let's say you've got ruptured bowel here and you don't know it, and it's going to seed the abdomen, it's going to get infected in there, and first thing you know, it's going to come.
So like I had an abscess because I had a burst appendix for a week before they took it out. I had an abscess in one of my thighs, and they found out because they did sonogram or whatever. But they tried to extract it with a huge freaking needle, but they couldn't. And so that's why I would ask that, because they never were able to extract anything. So yeah, I just went away after a while.
So what was done?
They didn't do anything.
Didn't put a drain in there?
They stabbed it. They kept on stabbing it with this big long needle, but they couldn't do anything.
they couldn't penetrate it?
Well, they weren't finding the pus.
They saw it. They were able to see it, but they couldn't. I don't know.
So they couldn't get it out with the syringe,
Yeah.
so they didn't operate and put a drain in there?
No, but it was in my thigh.
Oh, I thought
No.
it said appendix.
Yeah, appendix, but I was in the hospital for a week, so it drained down to my thigh.
Oh.
I was at the Winter Haven Hospital.
They call that the death trap, my word.
And what's the doctor?
To eat it.
Okay. Oh. Well, we can
Don't
talk
we
about
have
that.
antibiotics?
Let's go on. Let's go on.
Probably.
We got to move on. Okay, so we're still in non-specific defenses, aren't we?
Yes.
And I said one of those things that we talk about is antimicrobial proteins. So we have some proteins in the body that help us against foreign invaders. And we're now usually talking about pathogens, like viruses, or even bacteria. But one class of them is called interferons. They're antiviral proteins. Now, they can be produced by a variety of cells, as I've shown you here. But here's the way they work. Let's say that a person is infected with a virus, and this cell over here is infected. What this cell does then is release interferons that pass to neighboring cells and produce a blockage at the cell membrane of neighboring cells. So interferons don't prevent viral infection. What they try to do is retard it once it happens. That's their main role.
So that particular cell on the right then has not been affected?
No, it has not.
Okay, it's a healthy
It's-
cell.
It's blocked
Okay.
right here
Gotcha.
because
The interferon
of the-
came in. Okay.
of the action of the interferon.
It goes to the cell.
Hmm?
It
scopes
Like
the
a-
cell.
So is that where it gets its name
No,
from?
it puts a block at the cell
Signal.
membrane there.
Professor, is that where it gets its name from? Interferon to not interfere?
It interferes, exactly. Now, notice here that these interferons also activate macrophages and natural killer cells. Now, this is the basis of interferons sometimes being given to treat cancers. So, for example, someone has metastatic malignant melanoma. Melanoma is not responsive to chemotherapeutic agents or radiation. There's not much you can do for it at all. So oncologists sometimes, as sort of the last thing they can do, as sort of an act of desperation, will sometimes treat these patients with metastatic disease like melanoma with interferons because they activate macrophages and natural killer cells, hoping that macrophages and natural killer cells can wipe out these malignant cells. Most of the time it's not effective, but that is the basis of it, and that's why it's done.
I have a question. Why would they use that as a last resort? Like, what danger does it do?
Well, I'm saying they use it because nothing else works.
So why wouldn't you use that first?
Well, that's what they do. I mean, they know that there's no
Yeah.
chemotherapy ain't going to work, radiation doesn't work, so they treat with interferons.
I guess it's the only option.
Now, there's another antimicrobial protein called complement. This is a little bit more complex, but there is a specialized class of proteins in the blood made up of about 20 proteins that together are called complement. Complement. And what they do is attack cells that are affected or infected by foreign agents. And when activated, they, sort of like the natural killer cells, they puncture holes in the cell membrane and kill those cells. Notice that they also enhance phagocytosis and inflammation. There are two pathways, a classical pathway and an alternate pathway, but they both do the same thing. The difference is that the classical pathway requires that there be an antigen-antibody complex. In other words, the antibodies have attacked the antigen. They have actually, by doing that, they've given the proteins something better to grab hold of. But you don't have to have that, because it also works this way, without an antigen-antibody complex. Notice that they all come to the same thing. They puncture holes in the cell membranes of infected cells. And they also enhance inflammation. All right, fever can be a protective means against foreign things too, because when we have an infection going on, our body temperatures are set at a higher level. The hypothalamus does this. And we have things circulating in the blood called pyrogens that flip the temperature setting up higher. This can be beneficial unless the temperatures are extremely high, but moderately high temperatures may have some effect on denaturing the proteins in the pathogens. So it can be helpful, although when you're having it, it's not too pleasant, usually. All right, so that's our first and second lines of defense. Those are our general defenses. Now we're down to our immune response, our third line of defense. Okay, now let's compare our third line of defense, our immune responses, to our non-specific defense. Okay? These defense mechanisms against antigens that are met for the first time are not immediate. and I will show you why later. With our first line of defense, the attack is immediate, isn't it? All right? But there's a lag time here when you meet a new antigen. All right? However, this immune response is specific. It's very specific. It's systemic, meaning it's not just local. It's wherever in the body this antigen is, the system will seek it out. And it's recallable because these immune cells have memory. Now we have two mechanisms, and they work together. We have T cells and B cells. Now up here we're talking about something called cellular immunity or cell-mediated immunity. These are T cells. And they act by direct killing of cells that contain foreign antigens. The other side of this is humoral immunity, or antibody-mediated immunity, B cells. So we have antibodies acting against cells in body fluids. Now notice something about antibodies. They don't kill. Does that surprise you? They immobilize antigens, foreign antigens, until they can be eliminated by some other means. And we'll look at this later. All right, here is a little table that compares cellular and humoral immunity. So, here's the humoral category, here's cellular. So antibody secretion, where does that happen? Humoral immunity. Okay. What are the primary targets? Well, over here with cellular immunity, it's intracellular pathogens in fixed tissues and also cancer cells. Over here, it's mainly against foreign antigens in body fluids. Antibodies rarely enter tissues. Sometimes they will enter a lesion, but mostly they're acting in body fluids, extracellular fluid. Okay, where do these lymphocytes come from in these two categories? The red bone marrow. Where do they mature? T cells mature in the thymus, don't they? The B cells mature in the bone marrow, don't they? All right. Now, what are the cells? I mean, these are the cells that start the thing, the T cells and the B cells. But now there's more than one type of T cell. And we'll talk about these. You got several types here. 80% of them are this kind. These are the killer cells, right here. But we're going to find out that these cannot be effectual unless we have enough of these. All right? Plasma cells. So plasma cells come from B cells. B cells make these. And the plasma cells actually make the antibodies. All right? Now, do you have memory with both types of immunity here? You do. Whether it's T's or B's, you have a memory.
I have a question. I knew a child who had T-cell leukemia, or leukemia that was affecting the T cells. So basically what I guess I'm going to try to ask is that because the leukemia was specific to the T cells, any job that the T cells were supposed to do, they just couldn't do. Is that what I'm getting? Is that?
Well, malignant T cells are different from the natural T cells.
Okay.
So the malignant cells are not functional
Right.
in the normal way.
Right.
They're dysfunctional or non-functional. So what happens here, they're overwhelming the natural immunity, the natural T's and B's.
Okay.
All right, some definitions. Antigen. Antigen is generally considered something foreign, right? In fact, its name is a composite. It comes from antibody generating. Now, we usually think of antigens as foreign, something foreign to us, but we have to understand that we have on our body's cells self-antigens. So there's such a thing as self-antigens and foreign antigens. And so we're going to find out that our T cells have to be able to recognize both self-antigens and leave them alone, and foreign antigens and attack cells that contain those.
Is that where the recallable part of it comes into play? No.
No. I mean, that's a part of it, but that's not, we're not there yet.
Okay.
Okay. Now, a complete antigen means that a foreign substance enters your body and it can do you damage as entered. An incomplete antigen, sometimes called a hapten, is something that by itself would not be harmful to you, but if it combines with one of your body's proteins, it forms a molecule that your immune system perceives as foreign and will mount a defense against it. Example is penicillin allergy. See, not everybody is allergic to penicillin, are they? Okay, so penicillin is acting as a hapten here. Now, most antigens are proteins, but not necessarily all of them. Antibodies, on the other hand, are all proteins. And as we said, they come from the B lymphocyte line, that they're part of humoral immunity, and the plasma cells are the ones that make them, and antibodies act against foreign antigens in body fluids, primarily. All right. Now, types of immunity. Two big major categories here: innate immunity and acquired immunity. So, innate immunity means what we're born with and what is specific for our species. It's genetically determined. However, this innate immunity breaks down when there is severe immune system depression. This is what happens, for example, in HIV/AIDS. All right, then we have this category here of acquired immunity. Here's another way of looking at acquired immunity. Now, this immunity we're talking about now is in this category right here. It deals with antibodies. So it's humoral immunity. Now, this type of immunity can be either active or passive. Let's look over here at passive immunity. How can you have passive immunity? Well, it tells you right here. When you were in your mother's womb, there's a class of antibodies that can pass across the placental barrier. Okay, the IgD. So, when you came out of your mother's womb, you had some of her antibodies circulating in your bloodstream. And so basically, whatever she's immune to, you're immune to for a couple of 3 months. And if you were breastfed, you continue to be immunized against those things.
Isn't that why they say the first 2 or 3 days of breastfeeding is the most important, because that's where the majority of those antibodies are, is in the colostrum?
I'm not sure about that, but
Okay.
it makes sense.
Never breastfed, so okay, I can understand that. I understand.
You know?
After breastfeeding, does it go away? Does that bother you?
Yes, yes. The mother's protection will fade unless the person is immunized against certain things, or unless he or she acquires natural immunity. All right, so that's over here now. So just by living on this planet, we're going to come in contact with multiple foreign antigens, aren't we? And our immune system is going to develop antibodies. How do most antigens, foreign antigens, get into our bodies anyway?
You eat them, ingest them, airborne.
We breathe or ingest them, right? That's how most of them get in, right? Yeah. Now, but sometimes, and commonly these days, we have artificially acquired immunity in the form of immunizations, vaccines. These vaccines basically are attenuated, meaning weakened viruses or dead viruses that the body develops, an immunity to. And ostensibly, it makes you immune to whatever that organism was.
Can I ask a question about that? The flu shot. I've never had one. I've had the flu once in my life. I don't want to get a flu shot because I just know I'll be the person who comes down with the worst case of the flu ever from getting a flu shot. But that's what I see happen to people. They get a flu shot and then they wind up getting sick from it.
That's right.
I do every time.
That's right.
I've never had
That's
one.
not an uncommon story. And there's a reason for it. Now, in our society today, it's sort of standard procedure to be immunized against a bunch of things. And the list grows, doesn't it? And the persons who are most at risk for this are the very young and the very old. Let me just pose something to you. There is a significant body of research now that says that vaccines and immunizations are both ineffective and potentially harmful. This is why some people are opting not to have their children immunized. Just a minute. But nowadays, in our society, the conventional medical community highly promotes this. Most doctors, not all of them. And the government is behind it too, the CDC. But there are people now who are opting out for religious reasons or for personal reasons, and it depends on what state you're in, what kind of exemption is available to you. But it's gotten almost to the point where if you don't immunize your children, you're looked upon as evil and selfish, and you're harming others, and you're not even patriotic, for Pete's sake. So I'm just telling you that this is an alternative way of looking at this. I'm not telling you don't immunize your children or don't get immunized yourselves.
Options.
The point I'm making is for you to think about this and think it through and come to your own conclusions. All right? You need to read some on this. You need to read some alternative sources, because there's a lot of propaganda coming out. There's a recent thing out of Children's Hospital of Philadelphia where they're just really sitting on this real hard to be immunized.
When I was a kid, you didn't get a chicken pox shot. Your parents found a friend whose kid had chicken pox and they made you play with them. And that way you'd get it before you started school. Yeah. Get it over with.
There are...
You can't even go to school now without. My kids, they had to be
Yeah.
to be immunized to school?
Yeah, because
Yeah.
for seventh grade.
You have to be immunized before you can get in school.
Before you get in nursing?
You got to be immunized before you get in nursing school. Let me give you just one website where you can search for these things. And there are multiple articles on this website. But why don't you search immunizations or harmful effect of immunizations. And here's the website.
Mercola.
Mercola.com. Dr. Mercola is a physician. He's a DO, a doctor of osteopathy. I think his practices in Illinois. But he writes copiously. He interviews knowledgeable people. One of the articles you can find here is an article by Russell Blaylock, MD, a retired neurosurgeon who has studied extensively on the excitotoxicity of vaccines. I don't have time to go into all the details here, but when you get immunized, they give you a live or an attenuated or dead vaccine, but they also include something called an adjuvant. This is something to stimulate the immune system for as long a time as possible to help you get immunized against this. Those adjuvants are not harmless, and some of them contain heavy metals like aluminum and mercury.
That's why they say about some kids come down with autism. That's my question.
Yes. Is that your question?
Yes.
Autism. And there are cases in litigation right now on this very thing. Children who have become autistic from immunizations. There is a link. There is a link. Now, I know I'm going against conventional medicine here, but I'm just telling you, from my reading, by now you probably know that I don't accept hook, line, and sinker what comes out of conventional medicine. So I'm into alternative thinking on these things. But yes, what happens a lot of times is these folks, they have neurological damage. They will get depressed, even. Their neurological function deteriorates. There's also been a theoretical link to Parkinson's and Alzheimer's from this. So anyway, this is just something for you to think about and draw your own conclusions. All right, so pressing on. We didn't come to this category, did we? Passive, artificially acquired. What's that about? Oh, by the way, before we get into this, I alluded to the fact earlier that when you have an injection of a vaccine, you are bypassing the most important natural way that immunity occurs to foreign antigens. You're bypassing the surface antibodies on your skin and mucous membranes. But anyway, artificial immunity. Let's say that you have got your tetanus toxoid immunization. You've had the 3 shots. You've got the tetanus toxoid. Do you know what tetanus toxoid is for? It's not for infection by Clostridium tetani bacteria. What you're being immunized against is the exotoxin that's produced by an infection of those bacteria. So you're immunized against getting tetanus if you get a tetanus-prone wound. And that lasts, 10 years maybe, something like that. But let's say you got it, you can't remember when. It's at least 10, I don't know. So you got a tetanus-prone injury. You stepped on something in the barnyard, and you go to the emergency room, and they clean it out, and they wash it out good, and they sew it up, and they say, when was your last tetanus booster? And you say, I don't know, it's at least 10 years maybe. So they give you a tetanus booster. what they're giving you is something here. But they say, since it's been so long, we're going to give you some passive immunity, and they give this in the form of, well, Homotet or something like that. What this is a commercial preparation of anti-Clostridium tetani exotoxin. So if perchance you were to develop, or have the capacity to develop tetanus, you're protected against it immediately when you leave the emergency room.
Okay.
Another example. Say working in the hospital as a nurse, and you're starting an IV on a patient and you stick yourself accidentally. Theoretically, you got some of that patient's blood in you. What might that patient have? That could hurt you. Well, so hospitals typically have what they call a needle stick protocol. And so you go to the patient, explain, usually the patients are agreeable. They say, we want to draw your blood and run some tests. We're going to draw the nurse's blood too and run some tests. And so they do that. And let's say the nurse checks out, let's say we're checking hepatitis B and HIV. So the nurse blood checks out negative for both. The patient's blood checks negative for HIV, but shows a positive hepatitis B titer. Does that mean the patient has hepatitis now? Not necessarily, but it means that that patient's been exposed, and there is theoretically the possibility that that could have passed to the nurse. So we explain this to the nurse, and we send the nurse down to the emergency room to get an injection of immune globulin, anti-hepatitis B immune globulin. So that nurse has protection right now from hepatitis B.
Dr. When you say you have your 3 shots of the hepatitis B, they give you those shots. What if you don't build antibodies?
What if you what?
Don't build antibodies against it.
Why wouldn't you build antibodies?
You just don't. I did not have that
Series 300.
What
You
does
did?
that mean?
Like I had the measles, mumps, rubella, but I had to get it all over again because my body didn't take like mumps or something.
Well, now wait a minute. Was it your body,
They said I didn't
or
have
was
titers.
it possibly that the vaccine was ineffectual?
But it was too.
You make my point. It could have been that the vaccine was not potent enough. What they found with whooping cough, see, whooping cough is a big boom now. In California, there's a lot. What they found was they ran a study, and they found, talking about, you don't get your child immunized against whooping cough, you're a bad person. What they did was they ran a study after it settled down, and they found out that there was not a correlation between immunized and non-immunized who got whooping cough. There wasn't a correlation at all. They also found that the whooping cough vaccine was probably ineffectual because they had to give an extra series. It was not immunizing the kids against whooping cough.
Was it strong enough?
Not to make the kids
What's
get it,
wrong?
mom did it, dad did it. Anyone who comes in contact with the baby.
Okay.
What about the elderly? Because even now, they're saying that we should give
Pneumococcus and
booster on
meningococcus.
Right.
I ain't getting them. I've never had a flu vaccine. I'm not going to get one. I've never had the flu.
At the hospital, they're saying that new employees have to get immunized.
I know. My son
All the employees are gonna be the ones
my
that.
son in Atlanta is in project management. He's a consultant, and he just got on with Children's Hospital of Atlanta. And guess what? He had to have a barrage of immunizations before he could work there. Yeah. Okay. There are some interesting properties of immunity. Memory we talked about, and we'll talk about that some more. When you come in contact with a foreign antigen and your body builds a defense against it, those lymphocytes that are involved in that act against it right away, but they also hold some in reserve that has the capacity to remember that antigen, so that if you contact it again down the line, your response to it is going to be both faster and stronger. So that's what this is saying right here. Versatility means that, first of all, in our total lymphocyte number, folks, we have individual communities or populations of those lymphocytes that are specific against different antigens. I'll allude to this in a moment. All right, so they don't, when something foreign invades your body, they don't all 10 trillion of them converge on that. A few of them that are specific against that clone themselves and make more just like themselves to deal with that. So that's what this is saying right here. Now, our immune cells must recognize, first of all, and react against foreign antigens if we're going to have an effective response. But if they do not react against, well, first of all, let me read this. Our immune cells recognize and react against foreign antigens. They also recognize but do not react against self-antigens. I had to put a parenthesis in there because normally they don't react against self-antigens. But sometimes they do.
It's an autoimmune
And
disease.
this is what's called autoimmunity, when our immune cells act against our own cells. We'll talk about that later. Now here's an interesting one. When a foreign antigen invades our body, our immune cells recognize it. At least a certain community of them recognize it. Now, this is not what happens. When a foreign antigen invades our body doesn't have to search around and find some lymphocytes and train them and build up a population to meet this new antigen like, huh, where did that come from? That's not it. What happens is that the foreign antigen that enters your body just selects out the little population of lymphocytes that are already specific against that antigen. And they clone themselves, make more of their number, and they deal with it. So, this is what this is telling you down here. We have more than enough lymphocyte populations present in our bodies at this moment to confront all the antigens we will ever encounter in our lifetime. That's pretty mind-boggling to me. But that's the way it is. All right. Well, we've spent a little extra time on stuff, but hopefully it wasn't wasted. Normally we would get into this, but we'll leave it till